Hello there. I'm away from home at the moment, so I'm just going to do a little bit more of the analysing, I suppose, to some degree, the reporting from the Thirlwall inquiry from the 3rd of October, which are the several doctors that used to work, or some perhaps still do work at the Countess of Chester Hospital back in 2015 and 2016. I know a lot of other stuff is coming out at the moment. It's hard to keep up with it all. Lots of things going on in respect of Dr. Z.A., another anonymous doctor's testimonies, but also the doctor known as Dr. A in the trial, anonymous doctor again, that was meant to be a friend of Lucy Letby's, but is now known as Dr. U. Apparently it's the same person in the Thirlwall inquiry. Dr. A has been morphed into Dr. U. It's just been revealed that he sent approximately 1,400 messages to Lucy Letby, and yet he's trying to spin the yarn that he was the subject of her unwanted attentions, that sort of thing. So they're all rewriting history. They're all trying to present themselves in a completely different light in opposition to the behaviour that they engaged in then, and their attitudes and what they believed at that time. It's all backfilling and storytelling and fabrication to make themselves look as good as possible, both retrospectively back then but also now. So picking it up from where I left off, we're back the reporting. I'm taking it from not the transcript but the Sarah Napton Telegraph reporting from the 3rd of October, and we're still on Dr. Saladi, who was a consultant, or he was a registrar at the time. He was still sort of training actually in paediatrics, but none of these people are neonatologists. They certainly weren't then. Whether they've developed an interest in the interim, I don't know. Dr. Saladi said, it says here, babies would deteriorate at the Countess of Chester. Just to remind you, Dr. Saladi was the one that was highly aware of the Pseudomonas aeruginosa. Has been very explicit about his beliefs at that time, recalling his memory at that time of thinking that could well be responsible for these groupings of deaths at the time, that they'd found Pseudomonas on the taps, and he was aware that a lot of these babies are very premature, and that infection could be the root cause for all the deaths, if not, well, many of the deaths, if not all of them. Dr. Saladi, he certainly gives that impression anyway in his evidence that I mentioned in the previous video about this reporting. Dr. Saladi said babies would deteriorate at the Countess of Chester and be sent to other units and get better. That might feed into the idea that they get better in another unit, they come back and they get worse again because they're back in a place where infection and pathogens are at a very high rate, and there isn't the protocols there, and there isn't the staffing there to deal with them or to negate those threats to those vulnerable babies' lives. He told the inquiry that he thought, quote, "Are we missing something?" Close quote. But said the focus was looking for a medical explanation for the sudden collapses and deaths. Yeah, that's what they should have been doing. But they weren't really acknowledging the issues with the unit as a whole. The fact that the consultants were only doing 2 ward rounds a week. They should have been doing 2 a day. They weren't looking at themselves. That's the last thing they'd want to do, is look at themselves and how that they're failing. They're failing the patients routinely and systematically failing them, and that most of those babies should never have gone to the Countess of Chester Hospital. But of course they're not going to point that searchlight of truth on themselves, either then or certainly not now. He goes on to say, Dr. Saladi, that's the rain outside, it started raining quite heavily. We were seeing the babies with abdomen distension, and we were sending them to the regional units. That's Liverpool Women's Hospital and Alderhay. I think there's a third one as well, Arrow Park. They're all the level 3 units in that area, and they're coming back. He says they are coming back. I think English is his second language, so he says they're coming back because they are not finding anything, he told the inquiry. Dr. Saladi goes on to say, so I suspect I should have raised concerns. we were scratching our heads. I don't think we connected with all the other previous deaths. It's a bit broken, slightly broken English here. I was thinking that we are going through a bad patch. But the RCPCH report comes on later and actually identifies and lists and itemises all the issues and problems with that unit. And indeed, so does Alison Timmis, another consultant there, which I haven't seen her name as yet, called to give evidence. She says it's chaotic, and it's, I keep repeating this in her email to Tony Chambers, the chief executive, it's chaotic, it's unsafe, and babies are going to die because of the unit. Not because of an invented serial killer, but because of the state of the unit and how it's failing the patients. And she goes on to say, nobody's listening to us. None of these doctors go anywhere near that kind of statement at the moment at all, do they? Because they're kind of trying to be on script as much as possible, but they're leaking a certain amount out. So that's that section there. The next section, Dr. Saladi still said he feared that the parents of baby N were going to report into the General Medical Council for the substandard care of their child. I know that Dr. Michael McConville's going through he's been doing lots of, I think it's up to 27 podcasts now. He's going through all the babies. I haven't got to that baby, the episode where he covers baby N yet, so I don't know enough to talk about that. So you've got Dr. Saladi here saying that he's worried that parents are going to report him. The little boy needed to be resuscitated after collapsing unexpectedly on June the 15th, 2016. Just a note about the unexpectedly. If they're, as we know now, as they knew then actually, that blood cultures might miss signs of sepsis, you might get a negative result back, but the baby has got sepsis, well then, on what basis is it unexpected? It could be well expected if those other signs were being missed, because there wasn't enough cover, there wasn't enough senior cover, there weren't enough doctors, weren't enough nurses for the babies that were there. And so many things were being missed. You know, whether it was antibiotics for periods of 4 hours, whether it was fluids, all sorts of things were going wrong. Certain doctors didn't have the sufficient skills to do the procedures, and they need to try to do the procedures again and again and again. Somebody from a level 3 unit would come and do it straight away. So there's a catalogue of errors and a failure of care, essentially, in many cases, in probably all the cases, actually. Dr. Saladi said about this boy that needed to be resuscitated after collapsing, and Dr. Saladi said the team had struggled to secure the airway of the baby, that's baby N. Dr. Saladi said his mouth was dry and he could not answer the parents' questions about the collapse. Quote, he said, they didn't say anything about the GMC, but I thought they were unhappy with the care provided. So the parents understood it was about the care straight away. They got it. He said, I do not remember the exact words, but I think they said, you've provided substandard care. Yeah, they got it. They got it straight away. You can hear these active conversations that are happening that the doctors are aware of. And you can see these building up. So you get a catalogue of instances of substandard, suboptimal, as they call it, or substandard care. And these doctors are aware that they're very much on the back foot. They think we're going to be blamed here as they're seeing the death rate increase. And so they start casting around for someone they can blame it on. Because that would solve all their problems, wouldn't it? As horrific as that sounds, but that's the motivator. That's the growing motivation over time that they all join in with. Certainly Breary is one of the neonatal lead there. He certainly wants to push responsibility onto someone else, not himself, and certainly not the other doctors, not his chums, and not himself. So the next section, still Dr. Saladi. Dr. Saladi said paediatricians would only expect to see an unexplained baby death at a district hospital a couple of times in their career. I mean, he mentions elsewhere that he's quite new to this, that he's just come, so I'm not sure where he's getting that information from. and on what basis, and he'd obviously come from another country to do this. So, you know, I don't know how much weight to give to that. But who's deciding what's unexplained? You know, it's only, they're being selective about what's unexplained, they're being selected about what's unexpected. You know, when we looked at the statistical work that Dr. McLachlan did in relation to the other hospitals in the area, well, around the UK, but there was one in Blackpool, and there's other, the Sherwood Hospital, where they had higher rates of deaths in certain years than Countess of Chester. So were they all unexpected? Were they all expected then? Well, if they were expected, why were they so disparate to the other years? What made them? So, you know, there's something going on there. And this notion of that everything's always expected, everything's always explained, that's been blown out the water as well with different research that's been done, in which, you know, the final cause of death is unascertained on the post-mortem in a certain percentage of babies' deaths, which they did that in some in-depth research about that. So there's this false notion that Detective Hughes parrots that everything's explained and everything's expected. It's just absolute rubbish. Dr. Saladi, who kind of makes some points here which makes you think there's something about him that would want to be fair here, and he says the following. He said he found it, quote, difficult to swallow that somebody would be blamed for harming babies just because they were on duty at the time. He encapsulates there exactly what they did do and what the criminal justice system and the police ended up doing. They blame them for harming babies just because they're on duty. But a selected subset. Selected by who? By Breary, with help from others, but ostensibly by Breary, primarily by him. Then passed on to be replicated and essentially rubber-stamped by this pretend expert, this individual Evans, and then that done a third time in respect of Dr. Bowen. And nothing stops it, nothing gets in the way of that. And it's all in contravention of the post-mortems, all in contravention of the Dr. Jane Horden analysis of these deaths, and a second neonatologist and another forensic pathologist that looked into these deaths. All that gets overturned, starting with Breary, Evans in the middle, Bowen to seal the deal, but they're all just agreeing with each other as a fait accompli. It's a fait accompli as soon as Breary's chosen in these cases. Could have missed out Evans, and Bowen would have, you know, it could have chosen Bowen to do it, and that's the corruption we've got here, is that there was no independent nature to this analysis of these medical notes at all. It was just to confirm the suspicions, harden them up, and turn them into charges, and then turn them into convictions. That's what it was. So Saladi says here, goes on to say, I was thinking of my own time when I came to the UK, because I trained in India. And when I first came to the UK, I was attending all the sick children because I wanted to know how things are different. Quote, so to blame somebody because they were there was difficult for me to swallow at that stage. Well, why wouldn't it still be difficult for you to swallow, Dr. Saladi? What's changed fundamentally about your logical appraisal of that? It should still apply today. It's only because you've got this fact of the convictions, not the fact of the act of any deliberate harm, but the fact of the convictions has apparently changed his view, you know, that just because you're around a lot of sick children, because you're either choosing to get better training, more experience, or with Lucy Letby for that reason as well, but because she was doing so many shifts, so many night shifts, and being charged with looking after the babies with the highest acuity, because she was one of the relatively one of the highest qualified and experienced, not so much in years, but she'd done this specialist course at a level 3 unit, and so few other nurses had done it. So she was ipso facto aligned with these babies with the highest acuity. So she was going to be there when the likelihood was greatest that there would be problems. But you got Saladi here saying, well, at that time I can't swallow it because it doesn't make sense just because you're there. But now he's qualifying it by saying at that stage, so what's changed? Why would a few years change that? Because it's perfectly logical. It's perfectly logical, isn't it? It's like saying anybody who works in a, like a critical care setting, they are going to see more deaths than somebody who's just a GP, aren't they? They're going to see more in terms of actively with patients coming in. Not that many people die in a GP surgery, but somebody in a critical care unit, nurses and the doctors, they're going to be seeing deaths all the time. Doesn't mean they've murdered those patients. It's just because they're around that. There's high acuity cases, as it were. Dr. Saladi said that looking at the rota did not show definitively who was on, this is interesting, who was on the ward, because doctors and nurses from the paediatric units could also come in and go into the neonatal unit. Exactly. And he's making a lot of really good points here. And of course, that rota gets just thinned down from its original inception, which included the doctors. Breary just obviously gets rid of the doctors from that rota. Not interested in it, because of course they're beyond reproach, aren't they? And just has the nurses there. It's just a construction, as I've said all along. A construction of how you frame someone, how you stitch them up, by pushing away anything which would undermine your concept that will allow you to stitch them up. You don't want anything skewing that, do you? So you don't want the doctors in there. You don't want to look at all the deaths. You don't want to look at all the crashes. You become the sole decider of what is a crash, and thereby all the ones, because they're not recorded anyway formally, all the ones that did happen but you don't designate them a crash, you don't call them that, they all go by the way, they're all in shadow, they all go by the wayside, because then you can't ally them, you can't link them to Lucy Letby. He says here, Dr. Saladi, I worked with Lucy and she appeared as a competent nurse, so everyone says, and that's the truth of it. So I did not have any direct worry or suspicion on her. That's what he says here, on her. Dr. Saladi said that he felt that an independent investigation should have taken place, followed by contacting the police if there was evidence. Well, there was independent investigation. They got Dr. Jane Horden in, didn't they? And she didn't find any signs of harm. They got the second neonatologist, and then they got the forensic pathologist in as well. And the RCPCH report didn't find anything. And you got the pathologist, Dr. George Kakai, a very highly thought of pathologist doing the post-mortems, didn't find any signs of deliberate harm. So you've got all that happening, so you can't talk as though none of that's happening, like none of it's being double-checked, triple-checked. It's only it's only because Lucy's coming back to the unit in 2017. They don't want her back. So they flipped the nuclear switch. They would have left it otherwise. Breary and co. would have left it. They wouldn't have ever contacted the police. They would have left it. She's coming back, so they've forced the hand of the management and the police are contacted. And then you can't stop that train then. You can't stop it. Or they don't want to stop it, because they get deeper and deeper and deeper and deeper in. Then they've got to stick to the story that they've been yapping about for these 2 years, the bullying. They've got to justify their bullying, as it were. And then once Evans backs them up, then they're very deep in then. And it's moving forward. It's moving forward. Because they've got more and more to apologise for, actually. They're doubling down on the aggression and on the abuse of Lucy Letby. The further it goes on, the more, and when she's removed from her nursing duties, the more they've got to be guilty of, the more they are guilty of. So they feel they can't go back. They don't want to go back. They've got no courage. There's no honour in these people, in any of these doctors, to go back. Not a single one of these 7 doctors, if it's 7. As Gibbs says, it's not a gang of 4, it's a gang of 7. Not one of them has the honour to put their hands up and say, this isn't right. This is going too far now. There's no evidence of any harm here. No, they stay on the train, and then they want to turn it into a story of them being heroic in terms of fighting off a management that wouldn't listen to them. So they become the heroes of the hour and the whistleblowers. He finishes off saying in this section, Dr. Saladi said that he felt, I've read that bit. Oh, no, this is important. I haven't read this. He felt that an independent investigation should have taken place, followed by contacting the police if there was evidence. Well, there was never evidence. There's never been any evidence from then till now, and there never will be any evidence of deliberate harm. None. Not just that it's misconstrued evidence. There's none. There's no evidence. It's made up. It's completely made up by Evans. Completely made up. It's made up. All of it. And then that making up stuff is consolidated by Bowen and the other so-called experts at the trial. There's nothing there. It's not that they've kind of got it, they've made it up. They've made it up. Or in terms of the so-called insulin smoking gun cases, they've just conveniently missed out the fact that those immunoassays are not reliable in any way whatsoever to prove synthetic insulin, exogenous insulin, was given. He finishes off by saying here that Dr. Saladi says it in this bit. He feared that internal inquiries were, quote, coming across as doctors versus nurses. Again, that plural, nurses. Doctors versus nurses. He's really giving us a sense there that the nurses as a whole felt that the doctors were after them, but then they narrow it down, and they did narrow it down probably early on to Lucy Letby, but they felt, well, if they can do that to her, they can do that to any of us. And that's the feeling now. That's why there's that letter been written by a number of nurses, which is going to be delivered to the Prime Minister. I don't know if it's been delivered yet. I think I read somewhere it's like 174 signatures to that. Because people think, well, they can be next. That's how vulnerable nurses now are. If a bunch of doctors get you in their sights, and they don't want to be responsible for their bad practice and the bad running of the unit that they're managing, and the managers as well, then they'll just pass the buck and say, well, we've got another murdering nurse here, and they know it could happen to them. I might leave it there. Yeah, I'm going to leave it there, actually. Shall I leave it there? Yeah, there's a bit more of Dr. Saladi to go. So I finished off there where he's talking about that the internal inquiries are coming across as doctors versus nurses. But really, one of the internal inquiries that they order is the Jane Horden report, which is it's an external inquiry, isn't it? Because she works for a different hospital, different trust. They get her in. She doesn't find any evidence at all of deliberate harm. She asks for 4 cases to be looked into further. They are, and again, no evidence of deliberate harm was found. But it's not good enough for the doctors. It would have been, quote unquote, good enough for the doctors had Lucy not brought the grievance and had she not been coming back the following spring in 2017. Had she not done any of that, that it would have been a dumb thing. That it would have been over. They would have got it out of their kind of rage, their narcissism, their bullying out of their system to agree. In other words, they've got their scalp, they've pushed somebody out, it's made them feel better in some weird way. They're clearly not that concerned about the murders they believe in, because what did they do vis-a-vis contacting the police between when Lucy Letby's pushed out in beginning of July 2016? What did they do for the rest of the year? Nothing at all. And yet they had a meeting on the 29th of June. All these doctors, we're seeing the notes coming out now. They're seeing these notes coming out now in which they're actually writing, I think it's Breary doing it, I believe, taking the minutes. But it's the idea that, this is a potential witch hunt. And there's another line underneath it which says, not that I'm not up for it, and not that we're not up for it. So these are very strange people, very dangerous people, these doctors, very dangerous people to work with. When things go wrong, they're casting about, they're looking for someone. But the crucial point there is they keep talking about being on the cusp, but they should call the police. Should we call the police? When should we do it? Saying, oh, we might as well do it anyway if we're going to be downgraded. If we're going to be downgraded, we might as well do it anyway now. But they don't. And if you thought you'd, like Jairam, if you'd witnessed 13 months before, 13 months, well, at the time of that meeting, 6 months before, you'd witnessed this catching somebody, as the quote was, virtually red-handed, trying to murder a baby. You kept it to yourself. Kept it to yourself for 13 months, he did. That's how much he believed in, stroke cared about, A, that there was a quote-unquote murderer there, and B, that he had knowledge of it, and he could just keep it to himself, without going to the police, without going to anyone with that information. Until March 2017, he mentions it in a meeting with the management. Because he knows Lucy Letby's coming back, so he brings that, what he thinks is an ace out of ace. He lays an ace like that. But what is that ace? The fact that he's kept it quiet to himself for 13 months, that he's witnessed somebody virtually red-handed trying to murder a baby and kept it to himself. What does that say about him? What does it say about the likelihood of his genuine belief that he'd witnessed an attempted murder? It makes it unbelievable, doesn't it? It makes it totally and utterly unbelievable that he'd actually witnessed an attempted murder and kept it to himself. Something has to give in that kind of equation. He says later it's emblazoned on his memory, and he knew then that something terrible was going on, and it's virtually red-handed, but he keeps it to himself for over a year, and only brings it up to use for its utility, not its utility to, its pure utility to stop Lucy Letby coming back. Even at that point, had the management said, okay, we can't see that Lucy Letby has done anything wrong, but it's going to upset all of you, and had they kind of backed down, had the management back down to these consultants again and kind of acted badly towards Lucy Letby again, which they did in July 2016 by taking her off nursing duties. Had they done that again, the police wouldn't have heard of this case at all. That's how we know. That's how we know how fabricated it is, because they would never have gone to the police had Lucy Letby not been bringing that grievance and been coming back and forced them to apologise. That's what really got their goat. That's what really created that absolute narcissistic rage. They'd been threatened with a GMC, by the management. Told there's the line you don't cross anymore by the management. These doctors. There's another side issue. No, it's not a side issue. They're all very important, but that's coming up here with regard to the drug. The drug called Ranitidine, which is to do with acid formation in the stomach and like sort of anti-acid thing. But some of the babies may have been given this. We believe baby C was given this drug, and possibly some of the mothers. I've heard from an account by a person that used to be a midwife, or maybe still is a midwife, that mothers who are about to have cesarean delivery are given ranitidine. Ranitidine has been removed from the market certainly in the UK in 2019, I think it was, October 2019, because of its relationship to cancer, but also because of its relationship, I believe, it's in these studies, to the likelihood of increasing the risk of sepsis, of infection, and of NEC, necrotizing enterocolitis, which many of these babies that died ended up having markers of that and signs of that in the notes, inflammatory markers, all this kind of thing, albeit not necessarily on the blood culture results, because they can return false negatives that are not always picked up on them, apparently. But this drug, ranitidine, the studies that are out there, you can look it up, use of ranitidine in neonates. So we're going back to 2015, 2016 here, where it was used. I think the phrase that apparently is off-label because it wasn't designed for babies and never been tested for babies. I've been told that by Dr. Michael McConville. They were never tested for them, but they're given these medications sometimes, very premature neonates, and we believe baby C was given ranitidine. It's on an official document, so there could be a likelihood there, or a potential likelihood that increased the risk of sepsis and NEC for baby C by up to 7 times, according to studies that have been done. There's been numerous studies that have been done in respect of neonates and ranitidine in its relationship to increasing the likelihood of sepsis and necrotizing enterocolitis. So that's going on. So looking at my notes here, yeah, sometimes an oral ranitidine can be given to a mum before a cesarean. That was told to me by an account on Twitter called Lucy Letby Witch Hunt. Yeah, Lucy Letby Witch Hunt there. So in October 2019, ranitidine was withdrawn, so no longer you're allowed to give it, but they were giving it off-label to these very vulnerable neonates back in 2015 and 2016. So that's a kind of another issue that people are looking further into. In relation to the subject that we've been talking about, I asked Dr. Michael McConville about this, who's on Twitter under the handle @ReasonOverFear, @ReasonOverFear, and he's doing this brilliant series of podcasts. I've still yet to catch up with him. He's up to number 27 now. He's been going through every single case, incredible detail, with all his medical experience. 40 years of practice as a doctor. Really recommend listening to those. Called the other side of Lucy Letby. He responded to my tweet as follows. He said, "Mark, no medications are licensed for use in babies because they're never tested in babies. These are off-label uses." This is in respect to my question about ranitidine. "Off-label prescriptions in preterm neonates have been associated with many adverse outcomes and a higher risk of adverse reactions, medical errors, medication errors, and misuse. Studies have reported ADR rates," I had to look up that, adverse drug reactions, that is, ADR rates ranging from 23% to 60% in paediatric populations. One study found that 91.6% of neonates were exposed to harmful excipients. I remember looking that up as well. I'll just do it again. I can't remember exactly what that meant. Excipients. It's something that's in the drug that is not the main. An excipient is a substance formulated alongside the active ingredient of a medication. So they may be used to enhance the active ingredient's therapeutic properties, to facilitate drug absorption, etc., etc. Back to Michael McConville's tweet in response to my question to him. Specific drugs have been associated with serious adverse events. Oh yes, sorry, I missed this bit. One study found that 91.6% of neonates were exposed to harmful excipients, so that's elements of the medication that aren't the active element, with a higher percentage among immature neonates. So that's an extraordinary figure there. So specific, and he talks about some other things there. I'll put a link to the tweet that he writes in great detail, fantastic detail about this from a medical point of view. He goes on specifically to say the use of anti-reflux medications such as ranitidine in preterm infants, despite being unlicensed and lacking evidence of efficacy, has been associated with potential harm. These medications are frequently prescribed to very preterm infants, often without a diagnosis of gastroesophageal reflux disease, GORD, G-O-R-D. And their use has been linked to adverse events. So there's a history of that, going back to what I was saying about the research papers that have been done. Goes on to say here, preterm neonates have been highly exposed to off-label and unlicensed medications. Studies have reported that up to 99.5% of neonates in neonatal intensive care units in ICUs are exposed to off-label drugs, and up to 37.2% to unlicensed drugs. And he finishes off here very powerfully, Dr. McConville, in his tweet. Don't expect to hear any of this at the Thirlwall inquiry. So there we are, and he's got a lot of sources there, so I'll definitely link that below this video here. And I'll link one of the other studies in relation to the relationship to ranitidine, which was being given then, before it was withdrawn in 2019, but we're talking about 2015, 2016. It was being given. We know it was being given to baby C, and how many of the other babies was it being given? We don't know. I'm not sure if anyone's done further work on that yet, but we know it was given to baby C. And also, can some of these excipients and the active ingredients, if they're given to the mum, can they cross the placenta and then affect the baby in relationship to increasing likelihood of sepsis and NEC, NEC, and such like? I think people are going down this track as well. So it's another line of debate and argument and investigation, I think, and should be, but. Well, not at the Thirlwall inquiry, as Michael trenchantly puts it here. I think I'll leave it there, and I'll carry on doing this, because there's some other bits from, as I say, I'm still back on the 3rd of October with those doctors' evidence or testimony from the Thirlwall inquiry. There's a bit more to go, because there's some things that, there's a bit more Dr. Saladi, and then there's a third doctor, and she says some very unusual things, actually, I think, and very interesting things. So I'll carry on with that in another video. Thanks for listening, and I'll put the links below, the appropriate links. Thank you very much. Goodbye.